Okay, so of these five food groups, which of these five food groups, and there can be more than one, which of these five food groups do you think have the greatest or greater impact on the levels of sugar in your blood? I'll give you a moment to think about that. Okay, so the five food groups, fruits, vegetables, and dairy all have a greater effect on the sugar levels in the blood. And now, not all vegetables do, but the starchy vegetables, so things like the potatoes, the corns, and the beans, those vegetables have a higher or a greater effect of sugar level on the blood because they contain a higher level of carbohydrate content. Okay, so now moving on to explaining a little bit more about how these five food groups fit into the daily diet. So what's my plate all about? And now I'm introducing my plate because this is the new version of my pyramid, or the pyramid or the food pyramid, which you may have all have heard of before. The food pyramid has transitioned over time from a pyramid into a plate, and this is an indication or just a guide of how much or the portion sizes of each of these food groups, what they should be at your daily meal. And so first off, we'll start with fruits and vegetables. And now fruits, as you can see, is that red portion of the plate, and that is a little bit less than a quarter of the plate. And then you see vegetables, which is a little more than a quarter of the plate. And now the vegetables, these are considered the non-starchy vegetables, so your leafy greens, your broccoli, and your spinach, and your kale, those sorts of things would go in this non-starchy vegetable. We'll call it a quarter of the plate. Then moving on, we have a quarter of the plate designated for grains, and this would include your breads, your pastas, rice, but this would also extend to starchy vegetables like potatoes or beans even would fit in this quarter of the plate because they have a higher carbohydrate content than the starchy vegetables do. And then another quarter of the plate is designated for protein, and so this is your food items like fish, chicken, steak, or even hamburger patties. These would all go in that purple portion of the plate. And then off to the side, lastly but not least, we have a little circle for dairy. So this could be from milk to yogurt or even ice cream. This would also extend into that dairy portion. Okay, so now that we've discussed a little bit about what each of these food groups should look like on your plate, what the portion sizes should look like, let's talk about a little how we can arrange these in a little bit of a different manner in order to control the sugar levels of your body based on the information that we have learned from the previous slides about which should the food groups have the greatest impact or a higher impact on the sugar levels in the body. Because remember, we want to control those sugar levels in the body and keep them at an even level instead of having them range all over the place and causing problems like we mentioned, the blindness or even kidney issues or heart issues. So we'll look at something what is called Create Your Plate, and in a handout I will give you later, this Create Your Plate section is from the American Diabetes Association, so you can actually use this module online if you choose to use the internet. You can create your plate in different manners, and it will show you what types of protein items will go in the section, and carbohydrate or starch items, and then also vegetable items. But we can discuss this a little bit right now before you do this on your own. Okay, so in the red portion, there you've noticed that instead of four quarters of the plate, your plate is divided into one half, and then that other half is divided into a half as well. So first we'll discuss the red portion, which is a quarter of the plate, and it is reserved for protein. So as I mentioned from the previous slide, the protein is for food items like fish or chicken or even seafood that can go in that red portion. And now in the other quarter of the plate, the yellow portion of the plate, we have our grains and starchy vegetables or starchy foods. So that can range from rice, pasta, potatoes, beans, couscous, quinoa, any of those starchy vegetables or grains can go in that portion as well. And now the green portion, I'm sure as you have guessed, there is space for your non-starchy vegetables. So this is your eggplant, your green salad, if you decide to have some mixed greens with some spinach and arugula and kale, baby kale. Those can all go in that green portion of your plate. You can even choose to have carrots or asparagus or broccoli, whatever you may choose, but half your plate is usually designated for vegetables, non-starchy vegetables, and that is because they do not have as great of an impact on the levels of sugar in your blood as the grains or the starchy vegetables like potatoes do. And then those two circles that you see in the Create Your Plate section, one has a variety of berries in there, and that can be your extra fruit section, or you can have apples, you can have berries, grapes, anything in that little circle up there. And then the other section across from that is the section reserved for dairy. So if you decide to have a glass of milk or a half a cup to a cup of yogurt, non-fat, or if you decide to have even a little scoop of ice cream for dessert, then that would fit in that quarter as well. So now that we've discussed a little bit about how to create your plate, let's look at some examples. So first we'll start off with breakfast. So on the left, I'm sure that you can see we have pancakes, and there's also bananas on there, and there are a couple chocolate chips there too. So the pancakes, and I'm not saying that that's a bad option, but if you try to classify this according to the plate method, all of these items, the bananas, maybe even the chocolate chips and the pancakes definitely, would all fit in the grain or the starchy section of that plate. And so then we don't have any of the protein, and then we also don't have any vegetables in this plate. Now, on the other hand, for this breakfast plate, we have a couple slices of toast. Then for our grain section, we have cottage cheese, because that's primarily protein. We have cottage cheese for our protein section, and then we have a few cucumber slices for our non-starchy vegetable section. Now moving on to a lunch pattern. On the left, again, we see that there are fries in 1/3 of the plate. Then we have another third for our rice, and then we have a third for our fried chicken. And so again, it's not saying that you can't have fried chicken, but from the fries and the rice, those are both from the grain portion or the starchy portion of our plate. So we don't have any vegetable besides the green garnish that's hidden in that right corner. So now on the right hand side, we have a baked chicken, and then we have some corn off the cob for our starchy section. So we have our protein, and then we have our starchy section, and then our green beans with mushrooms, that is our non-starchy vegetable section of the plate. And then in the top right, you can actually see, if you look a little closer, you can see that there's a little glass of milk, and then there are a couple apple slices in that top left. And so that would fulfill our create our plate section if we look back a couple of slides. So then another example that we have here is fish and chips. And again, another fried option. I'm not saying you can't have fried food, but if you fit it in the proper portion, it should be okay. However, you see that we have the fried fish, and then we also have just another to-go boat of fried French fries, and then I think that's most likely a soda in the back. So we have just an oversized portion of our fried fish, fried protein, and then we have on the right of that same picture, we have French fries, which is considerably more than that quarter we would normally designate for our starchy section. So on the right, on that create your plate option, we have a nice piece of salmon, which we always have available from our a la carte menu at Villa Gardens. We have that quarter for salmon, and then we have a little section of potatoes, and then we also have our asparagus for our non-starchy vegetables. Lastly, for our create our plate, we're looking at one more. Again, on the left-hand side, it's just spaghetti, and then we see some olives back there. Olives we would consider as our fat, and then spaghetti, we have just an entire plate of carbohydrates here. So on the right-hand side, we're looking at rice, which we could also put a little bit of pasta in that bottom right-hand corner where the rice is. And then the top, we've added a little protein from those scallops. And then on the left-hand side of the create your plate option, we have a mixture of non-starchy vegetables, which is our carrots, broccoli, and peas, and a little bit of radish in there. Okay, so that's all for our dietary portion. We will go into a little bit more detail in our create your plate activity in our seminar later on. But moving on to how to manage diabetes with activity. Physical activity is another important portion of managing diabetes. Currently, about 28% of adults 50 years and older are physically inactive, and this is a statistic as of 2014. Physical activity is 30% higher, or physical inactivity, excuse me, is 30% higher in those with chronic disease. And then that number is also 4 out of 5 of the most costly chronic disease may be prevented by regular activity. So that may give you a little incentive to increase your activity in your day-to-day lifestyle. So now we have two types of activity that we'll discuss today. We have aerobic, and then we have a resistance. So aerobic is that cardiovascular activity that gets your heart rate elevated. So that could be brisk walking or running if you are still able to do that. And that type of activity is recommended by the government to at least 5 times per week. And then we also have resistance training, and so this is a strength training with weights or body weight, and this helps build muscles, which one may help reduce fractures, but also can help the body respond better to insulin, and this is recommended at least 2 times per week. So the types of aerobic activity, as I mentioned earlier, these are things like brisk walking or cycling, any of the machines that we have available in the gym for you in our community gym. And then we have resistance activity. So this is examples, these type of examples include weight machines that we have in our gym as well. You can use resistance bands, or you can also lift light weights, or even if you go grocery shopping and you tend to purchase canned goods or even water bottles, you can use those for resistance as well. These may also include lunges or squats if you like doing those too. And then Physical activity. How much is enough?